I'll be addressing the recent defunding and possible imminent closure of additional supervised consumption sites, which will have disproportionate impacts on people experiencing homelessness in Toronto. While surely not everyone who is homeless consumes drugs, and while not everyone who consumes drugs is homeless, peer-reviewed research shows that in 2021, 1 in 6 people who died from opioid toxicity in Ontario was a person experiencing homelessness. The defunding and closure of supervised consumption services will significantly harm people who use drugs, people who experience extreme poverty and homelessness, gender minorities, women, and Indigenous people. These have implications for this board's reconciliation efforts, as well as other frameworks designed to reduce health disparities among these marginalized populations. Access to addiction treatment and access to harm reduction must go hand in hand. It is widely accepted that for anyone who chooses to do so, the pursuit of abstinence is not a linear process. The increase in overdose risk immediately following a course of addiction treatment is well documented in the research, and therefore harm reduction and supervised consumption must be made available alongside one another. There will likely be hotspots of overdose emergencies in specific areas of the city should the site closures be permitted to proceed by this board. My recommendations to this board are as follows. 1, take all action necessary to ensure the remaining sites in Toronto which have been defunded can remain operational. 2, request that the medical officer of health work with other city divisions and urgently set up an emergency response table that includes paramedics, library workers, supervised consumption site workers and clients, drop-in and shelter workers, and other community organizations and medical professionals to participate. Request that the medical officer of health work with the Toronto Shelter Support Services on a strategy for providing medical directives on oxygen for shelters and drop-ins. That was 3. 4, request that the medical officer of health provide a follow-up on the anticipated impacts of the SCS closures report and include a summary of current impacts and recommendations. And 5, please make a statement supporting supervised consumption sites services as public discourse matters and evidence and expertise in disease prevention must guide our policy.